Hello, my name is Jason Brown. I'm a professor at University Hospital's Seidman Cancer Center with Case Western in Cleveland, Ohio. Today, I'm going to talk about whether any biomarkers predict response to immunotherapy. So just going through what I'm going to discuss in this talk today, I'm going to give some basics about biomarkers. Then I'm going to discuss a few of the different biomarkers that have been studied that might respond to immunotherapy. These include PD-L1, tumor mutation burden, neoantigens, the tumor microenvironment, metabolomics, genomics, and finally circulating tumor DNA. So to start with the basics, what is a biomarker? Biomarkers are measurable and they can be found in either body fluids such as blood, urine, or saliva, or tissues. Biomarkers can either be a sign of normal or an abnormal biologic process, in this case, cancer. There's really two main types of biomarkers that we study in bladder cancer research. The first is a prognostic biomarker. This predicts outcomes, for example, how long you might survive. So a biomarker that's prognostic of longer overall survival might be a good thing that you might find either in the tumor tissue or in the blood. On the other hand, a predictive biomarker answers the question of, will you respond to a particular therapy? In this case, we're looking for biomarkers that predict whether you would respond to immunotherapy or not. So biomarkers are developed from a patient, from a specimen. A lot of them involve molecular analysis. Then the data is analyzed in a lab, and then the specific biomarkers identified, and that could ultimately lead to personalized therapy. So what are some characteristics of a biomarker that's useful in the clinic? First of all, a biomarker needs to be accurate. We can't have too many false negatives and deny patients the care that they should be receiving. A biomarker must also be reproducible. Biomarkers are validated in the labs and must be the same test after test after test. Biomarkers also must be readily interpreted, meaning that a doctor orders the biomarker, but they need to be able to easily understand what does that biomarker tell them to make sure that that's the right biomarker to determine whether a patient should go on immunotherapy for bladder cancer. Biomarkers must also be affordable, so they can be used widespread in a number of facilities and a number of hospitals in both academic and community practice. And finally, biomarkers should have a quick turnaround time, especially because we're making important decisions about treatments that should be given.